Constipation is a widespread digestive issue that affects people of all ages, but for patients with liver disease, it poses significant risks. While often considered a minor inconvenience, constipation can become a critical concern for individuals suffering from liver disorders, especially advanced stages such as cirrhosis. The interplay between constipation and liver disease is complex, and understanding this relationship is essential to prevent potentially life-threatening complications. Understanding constipation and liver disease. Constipation refers to infrequent or difficult bowel movements, often accompanied by discomfort, bloating, and straining. In healthy individuals, it can usually be resolved with dietary changes or over-the-counter remedies. However, for liver disease patients, the consequences of unresolved constipation are far more severe, as it can directly impact liver function and overall health. Liver disease often impairs the body's ability to detoxify harmful substances, a function typically carried out by a healthy liver. When constipation occurs, waste materials and toxins remain in the intestines longer than usual. This delay leads to the increased production and absorption of ammonia and other toxic byproducts, which can accumulate in the bloodstream. The link between constipation and hepatic encephalopathy. One of the most dangerous complications of constipation in liver disease patients is hepatic encephalopathy, HE, a condition in which the accumulation of toxins like ammonia leads to impaired brain function. HE can manifest as mild confusion, mood changes, and forgetfulness in its early stages, progressing to severe disorientation, drowsiness, and in extreme cases, a coma. For individuals with liver disease, constipation acts as a catalyst for this condition. The longer stool remains in the colon, the more ammonia is produced by gut bacteria. This ammonia is absorbed into the bloodstream and transported to the brain, where it disrupts normal neurological function. Without prompt treatment, hepatic encephalopathy can become life-threatening. Why are liver disease patients more prone to constipation? Several factors contribute to the higher prevalence of constipation among those with liver disease. 1. Dietary restrictions. Liver disease patients are often placed on low-sodium diets to manage fluid retention. Unfortunately, these diets may lack sufficient fiber, which is essential for regular bowel movements. 2. Dehydration. Many liver disease patients are prescribed diuretics to reduce swelling and fluid buildup. While effective, these medications can lead to dehydration, making stool harder and more difficult to pass. 3. Reduced physical activity. Fatigue and muscle weakness are common symptoms of liver disease, leading to reduced physical activity. This inactivity slows down intestinal motility, contributing to constipation. 4. Medications. Certain drugs, including painkillers, antacids containing aluminum, and medications for liver conditions, can have constipation as a side effect. 5. Portal hypertension. Advanced liver disease often leads to portal hypertension, which can cause changes in blood flow and digestive function, further complicating bowel movements. The long-term consequences of constipation in liver disease. The impact of chronic constipation in liver disease patients extends beyond immediate discomfort. Persistent constipation can lead to 1. Worsening of liver function. The buildup of toxins due to constipation increases the workload on an already compromised liver, accelerating disease progression. 2. Higher risk of infections. Constipation can disrupt the gut microbiome, leading to bacterial overgrowth and increasing the risk of infections such as spontaneous bacterial peritonitis, SBP, in cirrhotic patients. 3. Hemorrhoids and rectal bleeding. Straining during bowel movements can lead to hemorrhoids, rectal bleeding, and even anal fissures, adding another layer of discomfort and potential complications. 4. Severe hepatic encephalopathy. As previously mentioned, constipation is a significant trigger for hepatic encephalopathy, which can rapidly progress without intervention. Managing constipation in liver disease patients. Given the risks, managing constipation in liver disease patients is crucial. Here are some strategies that can help. 1. Dietary modifications. Increase fiber intake through fruits, vegetables, and whole grains while being mindful of sodium restrictions. Consider incorporating natural laxatives like prunes or psyllium husk. 2. Hydration. Ensure adequate fluid intake unless restricted by a healthcare provider. Hydration softens stool and promotes regular bowel movements. 3. Physical activity. Encourage light exercise, such as walking, to stimulate intestinal motility. 4. Medications. Lactulose. This is a commonly prescribed laxative for liver disease patients. It not only alleviates constipation but also reduces ammonia levels in the blood, helping prevent hepatic encephalopathy. Stool softeners and osmotic laxatives. Use as directed by a healthcare professional. Avoid stimulant laxatives, as they can cause dependency. 5. Probiotics. Supplementing with probiotics may improve gut health and reduce the production of harmful toxins. 6. Regular monitoring. Track bowel habits and report any persistent constipation to a healthcare provider promptly. When to seek medical attention. Constipation in liver disease patients should never be ignored. Seek immediate medical attention if you notice any of the following: increased confusion or disorientation, severe abdominal pain or bloating, blood in the stool, inability to pass stool for several days. For individuals with liver disease, constipation is far more than a minor inconvenience. It is a dangerous symptom that can trigger serious complications like hepatic encephalopathy. Preventing and managing constipation is a critical aspect of liver disease care. Through dietary changes, adequate hydration, appropriate medications, and regular monitoring, the risks associated with constipation can be minimized. Patients and caregivers must remain vigilant, recognizing constipation as an urgent issue that requires prompt attention and action. Let me know if you need further adjustments.